So, have you ever wondered what it's like to be on the front lines of respiratory care?
Can't say I have. Enlighten me.
Well, I came across this fascinating story about a nurse named Katherine D. Larson,
Oh,
who
interesting.
works at Bisberg Hospital's Department of Lung and Infectious Diseases.
That sounds intense. What's her story?
She starts her day bright and early at 7 a.m., and the first thing she does is, check on her patients before even touching the charts.
Right.
She believes in seeing how they're doing firsthand.
Kind of like taking the temperature of the room, literally and figuratively.
Exactly. It's like she can sense if something's off before the data shows it.
Yeah. That's a real instinct for patient care?
Totally. She mentions that their patients can deteriorate rapidly, so being proactive is crucial.
I imagine working with respiratory patients requires you to be always on alert.
Absolutely. She deals with complex cases like severe COPD, asthma, and infections. And
Wow.
sometimes the patients can't breathe, which can be terrifying.
That's gotta be stressful for both the patient and the nurse.
For sure. She talked about a patient who was extremely bronchospastic and couldn't get air.
Oh, man.
She had to act fast, giving nebulized meds, saline inhalations, and even considering sedation to calm the patient down.
It's like being in a high-stakes game where every second counts.
Exactly. And she said sometimes they have to make decisions on the fly because waiting
Yeah.
isn't an option.
Do they have protocols for that, or is it more based on experience?
A bit of both, I think. They have guidelines, but she emphasized the importance of intuition and experience. She even helps train new nurses on using specialized equipment.
So they're constantly learning and teaching?
Exactly. And she mentioned how proud she is of her team. They
That's
have a
great.
unique camaraderie that's hard to find elsewhere.
Speaking of which, didn't she work elsewhere before returning?
Yes. She spent 4 years at the Thoracic Intensive Care Unit at Riggs Hospitalet, but came back because she missed the challenges and her colleagues.
Interesting. So she preferred the, fast-paced environment at Bisberg?
Exactly. She said they can do things not many others can.
Right.
Handling patients who deteriorate quickly requires special skills.
That's understandable, but do you think that level of intensity is sustainable?
That's a fair question. She doesn't mention burnout, but emphasizes the strong team support. That might help mitigate stress.
True, but even with support, constant high pressure can take its toll.
Definitely. Perhaps the passion she has for her work balances it out.
Could be.
She seems genuinely proud of what they achieve.
It's inspiring to hear about such dedication, but I still wonder how common it is to have such a supportive environment.
Good point. She seems to believe their department is unique in that way. Perhaps it's the shared challenges that bring them closer.
Like soldiers bonding in battle.
Exactly. It's like they're in the trenches together.
Right.
Facing difficult situations forms strong bonds.
Makes sense. So, did she mention any specific techniques they use that are unique?
Yes. They use devices like PEP flutes and non-invasive ventilation.
Interesting.
These require specialized training.
I've heard of NIV. It's like providing ventilatory support without intubation, right?
Yes, exactly. It helps patients with respiratory failure avoid more invasive procedures.
Got it.
It's a critical tool in their toolkit.
That's impressive. It must be rewarding to see patients recover because of your interventions.
Absolutely. She seems to thrive on those successes. She said no 2 days are alike, which keeps things interesting.
Variety is the spice of life, they say.
Haha, indeed. And she mentions that they often think ahead, even before the doctors arrive, so they're really proactive.
That kind of initiative can make a huge difference in patient outcomes.
Definitely. And she takes pride in that autonomy. She feels they're doing important work that not many others can do.
It's admirable. But do you think that level of autonomy is recognized and appreciated by the wider medical community?
I hope so. She did mention that when they call the MAT team, the intensivists often suggest things they've already done.
Right.
So they're respected for their expertise.
That's encouraging. It shows that their skills are acknowledged.
Exactly. It's like they're the unsung heroes in the hospital setting, making critical decisions that save lives.
Well, after hearing about Katherine's experience, I have a newfound respect for nurses in respiratory care.
Same here. It's inspiring to see such dedication and expertise. Makes you appreciate the healthcare professionals on the front lines.
Absolutely. So, any final thoughts on Katherine's story?
I think it's a testament to the impact that passion and teamwork can have in healthcare.
Agreed.
It's not just about individual skills, but about working together for the patient.
Well said. It's stories like this that remind us of the human side of medicine.
Definitely. It's about compassion, dedication, and, a willingness to go the extra mile.
Exactly.
Truly inspiring.
Thanks for sharing this story. It's been enlightening.
My pleasure. Always good to share inspiring tales.
Yeah.